While you may be quite familiar with the services offered by your general dentist, you may not know what a periodontist can do to improve your oral health. Periodontists specialize in the diagnosis, treatment, and prevention of gum disease as well as implant dentistry. In this video, we will be speaking with an experienced periodontist who will provide answers to frequently asked questions in order to help our patients become more familiar with periodontal health and treatments.
My name is Dr. Jyoti Sonkar. I am the new periodontist to the team, and I'm really excited to be here. I've done Masters in Public Health, AGD, perio residency, and I have been a professor at University of New England, Maine, where I also had a private practice. And recently I moved from Boston. I was a professor at Boston University, and just moving down south, and I'm enjoying the Texas weather for now, not missing the Boston fall and the cold weather at all, and I'm happy to be here. Periodontal disease is a very fascinating, mysterious condition. It's basically inflammation of the periodontium. A periodontium is basically the tissue. It's a soft tissue that supports the tooth in the socket. So anytime we eat and we have some sort of dental neglect, and for whatever XYZ reason, there is inflammation around those tissues, and if there is no accurate or timely care provided, this inflammation can go deep down into these soft tissue and eventually can pass on to the bone. And that's when you get loss of these tissues, and that's where the periodontal disease happens. So it's basically a chronic inflammatory, mostly bacterial infection of the gums. If your situation is more complex and demanding, and if you have gum disease, then periodontist will be your person to go. It would save you a lot of hassle and a lot of grief in the long run, because they're the experts and they're a little bit more trained compared to the other restorative dentists out there to handle such sort of challenging situations. So I would recommend that in this situation to visit a periodontist. So gum disease can be of varying severity. It could be mild, moderate, and severe. So depending on that, we have multitude of options. We could start with basic non-invasive procedures, that is a deep cleaning or scaling and root planing as we call it. And we could start with that. We could start with laser therapy, and depending on how the patient's medical condition is, the oral hygiene is, and how the anatomical factors is, a lot of times you're able to get a good success in controlling periodontal disease in this situation. But if it's more advanced and severe, then we do have some surgical options that we can use to not completely treat but stabilize the disease. Just keep in mind, periodontal disease is a irreversible condition. A lot of times the damage can be permanent, but our job is to stabilize and neutralize any of these conditions from getting worse. So we do offer a multitude of services, from non-invasive options to surgical interventions to provide relief to your condition. Absolutely, we do have a lot of advanced technologies where we provide different services that can help you with that. We do have lip stats, we do have vestibuloplasty, we do have aesthetic crown landings, multitude of procedures, and these are easy, quick. You just have to be under local anesthesia, meaning you don't have to be knocked out. You can just come in, and it's an outpatient procedure, and we can really help you with your smile during that time. So the first visit would be all about recording and charting the gums and understanding your concerns, your what you desire from us, and then based on that, that's how we move forward. It could be a dull intermittent pain, food getting stuck in between the teeth, just bleeding during brushing, or just spontaneous bleeding, There would be sensitivity. What else? We could have anesthetic, swollen gums, and the list goes on. Your teeth could be mobile for the period of time, and you would just have bad breath. So these are all the symptoms of periodontal disease. So when you are referred to a periodontist, a balanced dental care would be a combination of visits to each one of them, and depending on your condition, we would be recommending you a recall or a timely maintenance appointments where you would be alternating between your periodontist and your general dentist. Thank you for having me.